One of the things I hear a lot from moms when they're complaining about postpartum care in the States is how much better it is overseas, how much better it is in France, how much better it is in Europe, just how much better it is everywhere else. I had an interesting conversation last week that I think just confirmed that I don't think this is actually true. And my background, having kind of connected with some international physios, even, before Instagram and COVID and that sort of thing, at a global level, just kind of confirmed that. So anyway, I was having this discussion with a mom, and she is an expat and American in France. And she's like, you know what? First of all, there's not clarity between who's doing pelvic floor PT. Is it a midwife or is it a physio? And I do think physios, at least my understanding is the education background is different there than in the States. In the States, we're at a doctoral level profession. I don't think it's that. If any of you guys have any expertise or know any physios or are a physio and you're watching. But she was saying that, the midwife's trying to do a lot of the training, and the training, again, it's very, very like 15 years ago, very do your Kegels, for everything, no matter what. And then when that person asks to see a physio, of course, you've got turf wars. So this woman's trying to do what she, thinks she's supposed to be doing. She wants to get out and walk. She wants to take care of her kid. Having symptoms, I don't remember if it was leakage or prolapse, but it might have actually been both. But I think the big difference between now and, even 5 years ago is if you're in a country where that's standard of care, but you're also, scrolling through social media at 2 a.m. and you're saying, oh, that might not be what I actually need. And that's what happened with this person. She was like, I was scrolling through and she's like, I actually think I have overactivity. I actually think I have these other things going on. And I actually think that what they're giving me to do, A, it actually isn't helping. And B, I think I understand why it's not helping. That's such an incredible difference between clients now and even just a couple of years ago. Is I have moms coming in and telling me that the standard of care that they're getting, because that's what their insurance covers, or that's what, their medical covers, is not what they need. And I love it. And I'm frustrated with it for so many reasons. I love it because moms are getting educated, and that's so different than even just a couple years ago. But it drives me nuts because I'm fully aware that I know for sure in the United States, and I know for sure in other countries, there's a lot of practice patterns that have kind of, they're antiquated. And it's frustrating for moms when you see somebody like me or somebody else talking about, hey, actually, this is what you need. And you kind of have confirmed, that what you're being given isn't working. And you need to have access to that. And you don't know how. And you're like, I know I need this. I know I need something different. How do I get that? And that's where I think the frustrating part comes in is our health systems have let us down. Our providers are letting us down. And that's where I think if we're going to have change, a couple things have to happen. One, the change is going to come from moms. It has to come from demand, because if you're a provider and clients don't say anything, you think that everything you're doing is fine. So we can't necessarily always blame the providers. But it takes a lot of courage as a client or patient to go to your provider and say, hey, thanks, but I actually think this is what's going on. And I think that there's a better option, and then suggesting that provider try something different with you. And one of two things is going to happen. They're either going to put two middle fingers in your face and say, you don't know what you're talking about, or they're going to put their ego aside and say, you know what, you might be onto something. How can I help? And so that requires two courageous acts. One by the client to be like, I'm going to give you some feedback and it's not good. And the courage to ask for other options or ask that person to self-reflect. And it requires courage on the part of the provider to do something different. And the thing is, I've seen it happen over the years. I know that the capacity is there. The question is, how fast is this going to be? And again, I think that depends on if those that are behind all of a sudden are losing patients, if they are, it's going to come down to business, to be honest with you. If they're losing patients, if they're losing followers, if they're losing whatever, is that what's going to take them to wake up and be like, hey, what I'm doing isn't actually helping? And it also takes them to self-reflect and be like, hey, you know what? That person kind of disappeared. Maybe I should stop and ask them why they're not coming anymore. So it's this magnificent public health situation. And the world is so good at public health. But we get change because the public demands it. And I think we're getting there slowly. But tell me, I mean, if you're overseas, if you're in other countries, let me know what standard of care is for you. If you're in the States and you're running into that, you're running into care that does not match up with what you're seeing on social or what you're hearing from other experts, and you're asking for more, what's the response that you're getting? I'm really curious to hear. Hop into my DMs, let me know. I'd love to kind of get some feedback from you guys.